remember the overwhelming reason for the lack of trust in science and medicine is the bad actors who are weaponizing it at every turn. And now this has really taken off in this current administration. You've got the heads of the agencies saying now we're going to restore gold standard science to the NIH or FDA or CDC. It's nonsense, right? They've always had gold standard science. What they really want to do is put out gold standard pseudoscience. So there's a lot of gaslighting going on.
This is Dr. Chethan Sathya. Thank you for joining us for this week's episode of Northwell's 20-Minute Health Talk. We are honored today to be joined by Dr. Peter Hotez, a nationally renowned pediatrician, vaccine scientist, and public health expert. Peter, thank you so much for being here with us today.
It's great to see you and great to keep the connection with Northwell.
So, Dr. Hotez, you've devoted your entire career to vaccines, neglected diseases, public health communication. What originally drew you into this work? We want to know a little bit more about you, on the personal side. What brought you into this?
Well, there was what I sometimes say is there was the planned part, and as John Lennon says, life is what happens when you're busy making other plans. So the planned part was, like Kevin Tracy, who heads the Feinstein Institute, I wanted to be a physician scientist ever since I can remember. And I was in a combined MD PhD program at Weill Cornell Medical College and Rockefeller University. Began working on a hookworm anemia vaccine as an MD PhD student. Now 40 years later, we finally showed it works. And along the way so that's what I wanted to do. I wanted to make low-cost vaccines to help humanity. And then along the way, we started making coronavirus vaccines because they were orphaned very much like our hookworm anemia vaccine was orphaned. And that back then, this is pre-COVID, so the original SARS, severe acute respiratory syndrome, it came out of southern China in 2002, affected Toronto. Then there was Middle Eastern respiratory syndrome. So we were making those vaccines as well. And then when the COVID-19 sequence came online in early 2020, we pivoted our program and made that as well. So we made a low-cost COVID vaccine technology that was scaled up for production in India and Indonesia, and it wound up reaching 100 million people in those countries. And we provided proof of concept that it's possible to bypass big pharma companies and still do big things in the vaccine space. So that was kind of the planned part, and it went about as well as it can expected. And then came the unplanned part. And the unplanned part was, as an MD PhD student in the 1980s, in New York at Rockefeller and Cornell, I met my wife Ann. We lived, to tell you how long ago it was, we actually lived in Rockefeller University. It used to be the Rockefeller Institute for Medical Research housing for $44 a month on the Upper East Side of New York. And that's probably a bit more now. And we had 4 kids, including Rachel, who has autism and intellectual disabilities. And if you remember, the original assertion against vaccines was false claims that vaccines cause autism. So it was almost a decade ago. I got a request from the National Institutes of Health to explain to Robert F. Kennedy Jr. why vaccines don't cause autism. And you can see I wasn't very successful at it, but I spoke to him off and on for almost a year on cell phone and taking long walks with my wife Ann. But listening to all of his false assertions about vaccines prompted me to look everything up. And before I know it, I had a pile of notes about this thick, and he turned that around into a book with a very straightforward title. It was published by Johns Hopkins University Press, called "Vaccines Did Not Cause Rachel's Autism," something like my journey as a vaccine scientist, pediatrician, and autism dad. And that unfortunately made me public enemy number 1 or 2 with anti-vaccine groups. And so I became a target, but it also gave me this firsthand or front row seat insight into what the anti-vaccine movement is all about. So I became, therefore, both an expert not only in the vaccine science, but the vaccine anti-science. And then, there were a lot of things came together. And then, of course, the COVID-19 hit and came to the U.S. in 2020. I was one of the few American scientists who actually developed a coronavirus vaccine. So I was tapped to, go on the cable news channels on a regular basis, and that increased my visibility as a target as well. So I really got a deep dive into that whole anti-vaccine space, and wound up writing a couple of books just about that as well, in order to explain it to people. Because I think too often, we call it infodemic or misinformation as though it's just random junk out there on the internet. It's not. It's organized, it's deliberate, it's politically motivated, it's financially motivated, because it's links to the wellness influencer industry. So that
Wow.
causes me to be out there quite a bit in the public domain as well.
What a journey. What a journey. So lots to unpack there. We would probably need a few hours to get through everything. So you when you were a pediatrician, you never expected to be thrown into the public kind of Times Square like this, did you, when you were doing this work initially?
Yeah, that's right. I mean, that wasn't the plan. Not long ago, I got a call from one of my roommates from college, from 100 years ago, and I always know it's one of my people from my past, because in college and high school they used to call me Pete. So whenever the person says Pete on the other line, I know it's somebody from high school. So they call us Pete. We're talking. We always knew you wanted to be a laboratory investigator and as a doctor, scientist, and making vaccines, but none of us ever saw the public engagement part or the outreach part, and I didn't see it either. That it just kind of fell into it, and I found it meaningful. And now I realize that in terms of saving lives, I think our COVID vaccines may have, as I said, reached 100 million people, saved 300 to 500,000 lives. As meaningful as that is, my advocacy around vaccines and convincing people that explaining why vaccines are safe and effective and don't cause things like autism may turn out to be even more impactful, because the spreading of this anti-vaccine activist movement and the fact that it's now globalizing. So now I realize that's almost as important as making the vaccines themselves. And
yeah,
so I've taken it on, even though it sometimes takes you to a pretty dark and scary place at times.
Yeah, it's I can only imagine you kind of being front and center there. The all the things you've had to endure. So on a couple questions there. So you're a dad whose child has autism. And, one thing we've been focusing on this podcast particularly is how do we rebuild trust across public health? I think there are a number of different areas where we haven't done a great job in empathizing with others, having conversations about common ground and so on. But when it comes to vaccines, right, I think a lot of the science is pretty clear cut on certain things, as you've mentioned. One thing we talk about is our ability to empathize, right? Like relate with the people that we're speaking to. Now, again, you're a dad who has a child with this issue. Has that allowed you in any way to find common ground with other folks?
I think it has. And the other thing that was going on, if remember, in the first few months of the pandemic, when I was going on the cable news channels, CNN and MSNBC, I was even going on Fox News at the time before they kicked me off for not going along with the hydroxychloroquine nonsense. But so I was even going on Fox News, and back then it was literally in the corner of my bedroom with a few books in the back to make it look somewhat, academic. But what people didn't realize was on the other side of the laptop where I was broadcasting from was my wife, Ann, and often sitting on the sofa. And so, very much when I was speaking to the American people, I'd say, okay, because what was really interesting when I started doing this and going on the cable news channels, people gave me advice from the professional communications sector, and I didn't take it. And it went something like this. Remember, you got to really dumb it down, talk to the American people like they were in the 4th grade or the 6th grade. And I found that didn't work for my style. I would speak to the American people like I was talking to Ann, and, who is a Smith College. She's not a physician or a scientist, but she's a Smith College graduate and a smart lady and keeps up with the news. And I would keep it at that level, which was pretty high, right? Probably, pretty on the high end of the education level of the American people. And people liked it because I think they were tired of being spoken down to. I think there was this old-fashioned way of communication from the federal agencies that did say you have to talk to the American people like they're in the 4th grade or the 6th grade. And it sounded like baby talk. And I banked on the fact that everyone was like Anne and said, okay, hey, doc, tell me what I got to do to keep myself and my family safe, number one. And number two, and if you could actually explain some of the science behind it so I can help me understand and make sense of it, I'd appreciate that too, provided it didn't lapse too much into jargon. And that actually worked well for me. I think, so I can even give you a couple of examples of that. So, because I think examples are useful. So for instance, you remember when the mRNA vaccines rolled out at the end of December 2020, we were told, okay, there's 2 vaccines, there's Pfizer and Moderna, both mRNA, but the Pfizer, you're going to give 3 weeks apart, and the Moderna, you're going to give a month apart for 28 days, and then you're done. And I said, well, wait a minute. I mean, if you think about most since I'm also a pediatrician or trained as a pediatrician, if you think about most pediatric vaccines, that's not how it works. You give a series of primary immunizations, then you wait 6 months to a year and you give a boost. And that's what gives you the memory B cells and the more enduring immunity. So I said from the outset, hey, don't be, and I know we're saying 3 or 4 weeks apart, but don't be surprised if 6 months or a year from now, the word comes down to get a boost, because that's what we do for most vaccines, and people shouldn't be disappointed about that. And so then when that happened with the Delta wave, a few months later, I was looking like the smartest kid in the class. But what I didn't anticipate was that the mRNA technology, like all vaccines, have strengths and weaknesses, and with the mRNA, it was that the ability level of protect, even with the boost, is what we see for a lot of vaccines, probably because the mRNA is not making protein for very long, in contrast to what the anti-vaccine lobbyists have to say. So that took some explanation. I'll give you one other example very briefly. If you remember when the vaccines were rolled out, it was about stopping symptomatic illness, and no one said it was going to stop infection or transmission. But shortly after it rolled out, if you remember, the CDC was not doing much in the way of vaccine effectiveness studies. So we depended on the UK and Israel to do a lot of the effectiveness studies. And they only had the Pfizer vaccine. So you saw the results for Pfizer, you kind of extrapolated to Moderna, you figured it's about the same. And of course, the J&J, people got the J&J felt buyer's remorse because nobody was putting out information about
I remember that.
But that was frustrating for a lot of people. But the data from Israel, that first wave that hit in the summer of 2020 was, or the spring summer 2020 was the original lineage, and then the alpha wave came in the winter of 2021. And what the Israelis had shown, hey, wait a minute, the level of virus neutralizing antibody is so high that the antibodies are getting into the mucosa of the nose and the mouth and stopping virus shedding. This will stop transmission, so that and virus shedding, so that if you get vaccinated, you can actually take off your masks. And so I would explain that. But here's the problem. The problem was the CDC didn't give those underlying assumptions. So it was just, hey, now masks can come off. And I think that was a mistake in terms of how that was communicated, because the reasons for it should have been provided. And that was important, because then when the virus mutated to the Delta wave, to the Delta variant, the level of virus neutralizing antibody was not quite as high. And so it was still keeping you out of the hospital or preventing death, and it was still even stopping some level of infection, but not preventing virus transmission as well as you'd like. And that was the reason the masks had to come back on. But it was important to explain that. The problem with the way the message was communicated, masks come off, now masks have to come back on.
Yeah.
without the underlying assumptions. And I think so, in that sense, the communication wasn't perfect. But here was the bigger problem. As I often say, is the level of communication was imperfect. But at the end of the day, it actually wasn't all that terrible. There were definitely some mistakes made in terms of how communicate, but it wasn't that bad. The big problem was you had the bad actors weaponizing it at every step of the way. And you had these talking heads on Fox News. Many of them had medical degrees. Many of them were professors at important medical schools. And the Chiron, even though they weren't specialists in infectious diseases or vaccines, the Chiron at the bottom still listed, Johns Hopkins Medical School or Stanford Medical School. And that created a lot of damage also. So it was, I can't tell you how many Zoom calls I've been over the last few years about erosion of trust in science and medicine. And it always starts out, oh my God, everyone's wringing their hands. What did we do to screw this up? And then I interrupt and I say, wait a minute. Yes, it was imperfect, but it wasn't all that terrible. Remember, the overwhelming reason for the lack of trust in science and medicine is the bad actors were weaponizing it at every turn. And now this has really taken off in this current administration. You've got, you've got the heads of the agencies saying, now we're going to restore gold standard science to the NIH or FDA or CDC. It's nonsense, right? They've always had gold standard science. It's what they really want to do is put out gold standard pseudoscience. So there's a lot of gaslighting going on, or you see the things that the rhetoric that's coming out of the Humphrey building where HHS is. And so that's what's eroding trust, in my view, more than anything else.
Yeah, no, thank you for sharing that. I mean, I think it's a difficult moment, and we face these kind of conversations in the clinic all the time.
All of our friends and colleagues who've had heart attacks in their 60s, a lot of them, it's likely because of the COVID virus.
Yeah.
And yet what you hear from the anti-vaccine groups is that very rare myocarditis event. So what they do is they weaponize in young males. So what they do is they weaponize their rare side effects and don't tell you the most important thing you had to know.
Big question. But just very briefly, how do we have that conversation? Understanding that I think in other issues, I'll tell you, I think that on the communication side, you've done a great job bringing out the evidence and speaking to people like they're experts, right? People nowadays are very informed in many cases, as you mentioned. Now, it might be misinformation, but they're reading things. All too often, we kind of I found that sometimes we vilify folks. Right? We also add to this idea that maybe there's a them versus us situation, and maybe we're not empathizing with why they feel a certain way. So in the context of the physician-patient relationship, of course, empathy needs to remain central, right? To build that relationship and have that conversation. But how do we do that on vaccines? Such a contentious issue right now, with the right level of nuance and communicating some level of uncertainty that we actually get our patients to take the vaccines that they really need to take versus make informed decisions about the ones that maybe they don't have to.
Yeah, no, I think you've asked, it's probably the most important question, and now I'm going to have to give you a pretty long, I don't know the answer to your question answer.
Please.
But I think everyone's trying to figure it out, but it goes something like this. I mean, first of all, you're getting your patients now coming in, downloading all this stuff on the internet, and some of them are coming into your office making you feel like you're not keeping up with the literature. Well, you are keeping up with the literature. You're just not keeping up with the fake stuff. And so the disinformation is so omnipresent and so pervasive. So you're made to feel like you're not keeping up with the literature. Well, you are, but just not with the fake stuff. And so I think the first thing to remember is, your patients who are downloading this stuff themselves are victims. They're targeted victims of a disinformation campaign. And that might help you look upon them with some degree of sympathy and support. And so unfortunately, it requires you to get educated on what their false notions are. So the first thing I would do is ask them where they're getting their news. And unfortunately, the anti-vaccine rhetoric, and actually all anti-science rhetoric, is becoming more science-y sounding and made to sound like it's legitimate, and that's by design. So let me give you another example. So you had our good friend, the Florida Surgeon General, Dr. Ladapo. First he calls vaccines the Antichrist. Oh, great. And then what does he say? He says, well, the mRNA vaccines are causing turbo cancers. Why? Because the lipid nanoparticle is contaminated with some DNA that's inserting into our genome next to oncogenes and activating cancer genes. And you say, that sounds serious, right? That sounds like it sounds very sciencey, right? Except it's all BS, right? Because first of all, there's no such thing as a turbo cancer. That's a completely made up term. That's the first thing. Second, the lipid nanoparticle delivers nucleic acid past the cell membrane into the cytoplasm, but to get things past the nuclear membrane into the nucleus, you need electroporation, and that's a very complicated process. It's the reason why we have no licensed DNA vaccines. And then, even if some nucleic acid were perchance going to get into the nucleus, we have interferon-inducible elements of our innate immune system that block integration of foreign nucleic acid into our genome. Otherwise, every time we ate a hamburger, we'd have cow DNA in our genome, and that doesn't happen, and much less next to an oncogene. So there is an answer. The problem is, most physicians are probably, 10 to 15 years away from their first year biochemistry course. And even then, it's hard for them to connect the dots. And so what do? They go scouring on the internet to find it. And the real answers are scattered over about 10 different internet sites. And who's got the time for that, right? You're trying to, run your practice and everything else. And one of the things that I've suggested for years, even before this current regime, to the CDC is to create an Uber website that lists, the 50 most common anti-vaccine tropes and actually debunks them and says why they're not true, backed with references and things like that. Because not only would it be could the patient or the parent of the patient download that, but it would help the primary care provider. Especially some of the internists and OBs don't get the same level of vaccine training that the pediatricians do. So I think those are the kinds of things that we need to start thinking about.
Yeah. Well said. I mean, I think resources like that would be hugely resourceful, and I think you're right. I mean, people don't know right now where to look on the healthcare side because the amount of information out there is overwhelming. Can you comment specifically? So
if Northwell were to create it, and I'd be happy to help you to do it,
done.
I think it would go gangbusters. It would do well.
Okay, great. Our next project with you for sure. Can you comment a little bit specifically on, let's just start with, on the vaccination side, right? Specific questions, COVID and flu, right? We get a ton of questions right now around those vaccines, sorry. Should patients be getting them? Do you think everyone should be getting both those vaccines, either or?
I think so, and for a couple of reasons. I think one of the most important reasons, and this may be the most important piece of information in this podcast we're doing together today, is, we think of COVID virus, SARS-2 coronavirus, or influenza as a respiratory virus, but we forget the impact on our cardiovascular system. Influenza causes heart attacks. COVID-19, the virus, is a thromboembolic virus. It causes clots to form in your coronary artery and your vasculature going to your brain. That's the virus. And so it turns out, and the data is very clear in supporting it, one of the best ways to protect your heart health is to keep up with your COVID vaccines and to keep up with your flu vaccines. And I think we have largely failed to get that message out, even though I think that could be the one piece of information people haven't heard yet that I think could be extremely useful for them. So I think that's really important. And, flu's not looking great this year. There's this new K subvariant, and the vaccine will be just partially protective, but at least there's some protective effect and will increase the likelihood you'll stay out of the hospital or worse. And same with keeping up with your COVID immunizations. If you've not been, immunized over the last 6 months, when you look at the COVID numbers, they're starting, and the wastewater numbers, which tend to be pretty reflective, they look like they're starting to go up again, as they usually do as we head into January, February. So yeah, and by the way, and while we're on the subject of COVID vaccines and flu vaccines, don't forget your RSV vaccine if you haven't gotten that, and don't forget your pneumococcal vaccine as well. So, one of the things that observation I've made, and I had this conversation, as I say, I'm a pediatrician, not an internist, but I've had this conversation with the American College of Physicians, which is, publishes the Annals of Internal Medicine, and they're focused on internal medicine, is there's, from the time many of us were trained till now, all of these new vaccinations for adults have come online, including vaccinations for pregnant women like Tdap and flu and others. And so there's a pretty steep learning curve. And I think the American people have not really been fully educated as they should about the importance of adults getting their vaccines. And part of it is because it is so easy to get it by going to the pharmacy. And pharmacists now are being asked to learn about vaccinations at a different level from what they've been before. But also, there needs to be more contact between the internists, the OBs, the family medicine docs, and their adult patients about the importance of all of these new adult vaccines coming online, with some exciting collateral benefits as well. Exciting studies on the Shingrix, the shingles vaccine, and having some protective effects against dementia, which is really impressive. Or COVID vaccines are helping to promote some level of cancer immunity. Most adults have not heard those two stories also. So there's a lot of really important health information around adult immunizations that word hasn't gotten out yet. That's why when you offered the opportunity for me to talk to you on this podcast, I jumped at it, because this is the perfect venue for this.
It's huge. No, that's such a, important way of looking at the benefits. You mentioned heart health, right? I mean, people, I'm not hearing what you just said in almost any other discussion I've heard on this topic. That has definitely not permeated to the level of like the regular American, right? Thinking about this as a preventative thing as well. While the focus is just largely, I feel, on, okay, well, I'm going to weather the storm. I'll be a little bit sick this year. I'll be a little bit more symptomatic, but that's fine. I'm worried about the risks of the vaccine.
All of our friends and colleagues who've had heart attacks in their 60s, a lot of them, it's likely because of the COVID virus. And yet what you hear from the anti-vaccine groups is that very rare myocarditis event. So what they do is they weaponize, in young males. So what they do is they weaponize their rare side effects and don't tell you the most important thing you had to know. And then regards to influenza, I don't know if you know the rock band Rush, headed by the lead singer is this Canadian guy, Eddie Lee, and I was listening to an interview he was doing. I don't know, I was on an airplane or something, just happened to hear an interview he was doing. He was talking about how his dad died pretty young because he was in bed sick with the flu and had a heart attack. Well, guess what? That's what influenza does. So I think we need to have more of those stories come out.
Yeah, absolutely. I am Canadian, so definitely appreciate appreciate the Rush reference.
He's a minor deity for.
Yeah, exactly. Another topic that element of this that really permeates the public debate is, of course, individual health versus public health, right? And we, in the field, of course, we know that policies are required at a community level to be able to keep everybody safe. I don't think that people are really understanding the ripple effects of some of these decisions when they're just looking at the individual aspect, right? Now, again, I believe tremendously in nuance around this. I think there are individual decisions that can be made about certain vaccines, and that includes probably flu and COVID versus in current state versus, I think, MMR, polio, Hep B are in a different category, just in my opinion. But with respect to the Hep B discussion right now, right, around newborns being vaccinated and so on, I mean, I've seen a lot of those long-term effects of what Hep B does to those livers. And are people failing to understand that if you vaccinate less and this virus becomes more prevalent, that it could affect their families, right? Like not everyone is immune to this, right? There's a sense that this is just an individual decision and not a public health one. I mean, what are your recommendations on the Hep B side? And what do you think about this individual versus public good kind of narrative?
Well, before we get specifically into hepatitis B, remember what this MAHA movement wants. It's all about, it's basically an economic stimulus plan for the health and wellness influencer industry. It's very corrupt. And, have you ever wondered why they're always pushing anti-parasitic drugs, hydroxychloroquine, ivermectin, fenbendazole? It's because they can buy it up in bulk for cheap and then jack up the price and sell it with a $1,600 telehealth visit. That's the business model. But the other part of their business model is disparaging vaccines. So they're trying to steadily make vaccines unavailable. So, and unfortunately, they're being very successful at it. So measles has come back to America.
Yep.
And because, Kennedy's been saying outright misinformation about the MMR vaccine. He said it's a leaky vaccine or it declines in protective immunity 4% a year, which is nonsense. It's, if anything, it's 0.04% per year. And then he wants to separate the M from the R, which of course the pharma companies are not in a position to do because it would cost hundreds of millions of dollars and take 5 to 7 years to do all the comparability studies. And then he wants to make the diphtheria, pertussis, tetanus vaccine unavailable. So by saying he wants to remove aluminum alum adjuvants from vaccines, even though they're probably the safest, one of the most effective adjuvants we have. And we would know that 5 to 7 years of work to find an alternative adjuvant. So that would take the DPT vaccine off the market. And guess what's happening now? We've had the return of measles to America. It's been going on, transmission been going on for, since the beginning of the year. Two needless deaths among kids whose parents decided not to vaccinate them, believing this nonsense, and then 100 hospitalizations, and then pertussis is back. So yes. In that context, that's what hepatitis B is all about. And, he, again, false information, saying that all of the transmission, that if you test mom and she's shown to be negative, the risk is low, but actually almost as many babies get infected by household transmission after the baby comes home, which people don't realize, or in daycare. And so hepatitis B is coming back. Then now he's about to come out and say, I think this will happen early next year, he wants to go to the Denmark schedule, and he picked that because they give the least vaccines, so they don't vaccinate against meningococcal meningitis. And I've taken care of teenagers with meningococcal meningitis. It's a horrible disease with a high fatality rate, or he wants to stop rotavirus immunization. So it's all about making vaccines unavailable to the American people, despite, his statement saying, no, that's not what he's doing. That's exactly what he's trying to do. And so one of the things I say about the anti-vaccine activists is, remember about anti-vaccine activists, they don't care about you, they don't care about your family, they have another agenda. And I'm not going to try to dissect out what Mr. Kennedy's agenda is, but it's very dangerous for you, your family, and for the public health of the nation. Yeah. Points well taken. I mean, on vaccines in specific, I mean, your articulation of those ripple effects, people need to understand that, right? It will affect their families. It will affect their grandkids, may affect them. So I think I really do like the way that you worded that. Now, I want to caveat all this and say that I think the MAHA movement, or the health freedom group movement adjacent to MAHA, there are many folks I've met where I have been able to find common ground on other topics, right? I don't disagree, for example, on the need for more drug transparency. I disagree on some of the reforms that need to maybe happen at the NIH, right? I don't disagree on removing drug advertising on our media channels, right? So there are rooms for agreement. So but when you're speaking about the anti-vax movement, just want to point out, right? Because we have had some folks on this
pod or in conversation that might support some of these other elements, but not the vaccine part.
Yeah, but you know, I totally hear you, and I even agree with you. I mean, there are things that, you know, the MAHA movement pushes, you know, getting rid of processed foods and reducing, you know, sugar in the diet and exercise. And, you know, I don't really need to hear about an erection lasting 4 hours on
Brian Johnson.
I'm trying to watch CNN at night, you know. But, and sure, I mean, I think that's all fine, but it's you know, I mean, is this the regime that's going to be able to actually do that? So far, they've not shown any track record of accomplishment. All they've been able to do so far is kind of tear things down. So if they're successful in some of those things, I think that's great. But we'll see. We'll see how it goes.
Yeah. So parting thoughts, again, we could speak for hours. I have so many questions. I've already learned a ton about vaccines just in speaking with you. So I thank you. And hopefully our listeners have as well. What's the path forward, Peter? Because, you know, you mentioned a couple things, right? When doubts are raised around certain things, for example, the aluminum in a vaccine, and you can't definitively say that, okay, maybe there's not an eventual association between this and some rate of something abstract. People want answers to questions. How do we go about finding consensus to answer questions where there's areas of doubt while not compromising these life-saving vaccines, for example? Like, what is the path forward for us to build these bridges and move forward? Because you've been at the forefront of this, and you know, I commend you on your courage for speaking out and kind of telling everyone about the science, but what's the path forward?
I think, you know, I do think we as physicians, you know, have to learn to speak more in simple declarative sentences. I mean, you know, for instance, even the title of one of my books, Vaccines Did Not Cause Rachel's Autism. That's actually not generally how we say it, right? But what, you know, the forerunner of the National Academy of Medicine was then called the Institute of Medicine in 2013. What was their statement? They said the preponderance of evidence to date cannot identify any clear association between vaccines and autism. And we know what they mean, but the average layperson say, well, what are these guys hiding here? And so I think we sort of get ourselves into trouble by being so cautious about, you know, saying it in a very stilted way, that when we're talking to our colleagues, that our patients sometimes fail to understand what we're really trying to say. So I think talking in a more straightforward way, and as I say, I talk to the American people like I talk to Anne, you know, like I talk to, you know, a smart, educated individual, and I think people will appreciate that. But I think we're going to have, it's not going to get better right away. I think, you know, we're already seeing the plan, you know, for what's going to happen in 2026 in terms of the anti-science rhetoric coming out of Health and Human Services and the agencies. Now, in some cases, you've got the individual states are forming coalitions to band together to counter it. So New York has entered into an alliance, I think, with Massachusetts and New Jersey, and then a similar thing's happening in West Coast states. We shouldn't have to do this, but we'll see. I mean, as hopefully there will be some autocorrection in all this, but I think it's going to continue to be a rough ride for the time being. So what can I say? Put your tray table up in the upright lock position and seat forward, and make sure your seatbelts are firmly fastened.
Yes.
And when you get off the plane, make sure you put your shade down so the plane doesn't warm up. So.
I love it. I love it. Peter, thank you so much for being with us today. We really appreciate it.
Thank you, and thanks for all you're doing to get important health information out there. It's really important what you and Northwell are doing.
Thank you. This is Dr. Chethan Sathya. Thank you for tuning in for this episode of Northwell's 20-Minute Health Talk.